As the federal opposition leader prepares to present his budget reply tonight, Indigenous groups have welcomed a $33 million injection into health services for Indigenous Australians. The funding will include regional and remote health, as well as assistance for training and workforce development. But there is concern the budget's fallen short in helping to improve infrastructure in the nation's remote communities. For reaction, I'm joined by the chair of the National Aboriginal Community-Controlled Health Organisation, Donnella Mills. Donnella, a very good afternoon to you this afternoon. What's your reaction to the initiatives that have been outlined in the budget?
Thanks for having me on, Glenn. Yeah, the budget announcement. We welcome the increase in the funding for Aboriginal and Torres Islander health. You know, the increase of the $33 million for the Indigenous Australians Health Program, that was announced in August, and what we saw was it was included in the budget. It'll relieve a little of the pressure on our 550 clinics across the country. Those very clinics have been so successful in fighting the pandemic. We're also pleased to hear of the regional and remote health funding that will assist many of our clinics and the communities they serve, as well as assistance for training and workforce development. But as you said, we are in dire need of having funds for infrastructure, and this budget has overlooked that. While the health measures are significant, we need the government to put in targeted infrastructure investment in our 550 clinics.
So just tell us about those clinics and what needed to be invested to try to bring those up to scratch, and how many people benefit from the work that those clinics do. Infrastructure. What we saw from the budget is it's a big budget. Enormous amount of funds are going into infrastructure. What we needed to see in our sector was money allocated to investment within that infrastructure. We have a number of clinics. Some of our clinics are 40 years old. Some of them are 50 years old. They are in dire need for real investment. They've been underinvested historically. So by having that investment, it increases our capacity. It increases our workforce. It injects funds into our local communities, which bring jobs, which give opportunities to families to have employment. Also increases the opportunity for improved health and well-being because we can offer more services directly on the ground. Infrastructure is key to how we can deliver for our communities. And what about the national agreement on closing the gap? Has enough been done there, given that the federal government announced a few months ago that $46.5 million?
NACCHO believes that the Commonwealth could have strengthened its commitment to the new national agreement on closing the gap in the budget. Further investment in Aboriginal and Torres Islander programs would have been a clear demonstration of the Commonwealth's commitment, their true commitment to the new arrangements. As you said, the $46.5 million is over 4 years to build the capacity of Aboriginal and Torres Strait Islander community-controlled service delivery. That amount, that's just keeping us floating. Now is the time for the Commonwealth and state governments to commit to specific measures related to the new 16 targets for closing the gap. The budget did not deliver sufficiently to meet those targets, but my hope is that the next budget is slightly more ambitious.
And what about social housing? That's been a big focus for the critics of the budget, including the federal opposition, of course. How big of an impact could social housing have on Indigenous communities?
Enormous. It's an opportunity that's been lost to address historic funding shortfalls in social housing. We welcome the funding for the 360 home loans through IBA, but that's a drop in the ocean. The neglect, the historical neglect of social housing, and if I can just frame it for the listeners, when we think about it, let's just focus on the Northern Territory as an example. The housing standard is absolutely appalling that my people face across every jurisdiction.
but in the Territory it's exacerbated to a higher level. What we have on average are 17 people living in tiny, dilapidated homes. What that does is, how can you improve your health, improve your well-being when you're living in a home that doesn't have good health hardware? When you're 17 people trying to use one washing machine, one shower, one toilet. So disappointing, but we will continue to press this conversation with government around the need to address the housing shortfall.
All right, Donnella, appreciate your time this afternoon.
Thanks, Glenn.
That is the chair of the National Aboriginal Community Controlled Health Organisation, Donnella Mills there.